Hey everybody, welcome back to the Pet Food Puzzle Guy. And today I'm going to try something a little different. Sometimes I share information from Dr. Ray's channel. She's a practicing veterinarian that actually inspired me to start my channel. And I don't want to just be a channel where I just critique or I just counter all the bad misinformation, though I really do have a passion for doing that, and I do feel that's my role. I also, with my channel, I want to share any good information that I see out there. And Dr. Ray is clearly one of them. But also, I discovered a veterinarian out of Vancouver, Canada. Dr. Burston is his name. And I'm going to share from his video on cat or feline kidney disease. And if you're a cat parent, especially multiple cats, you've had cats over the years, you've experienced renal disease. Kidney disease is just one of those things. It's not a question of if, it's really a question of when. It's one of the big killers of older cats, and he goes into this and he explains it really well. I think he's just awesome, and I'll amplify a couple of his points that have to do with nutrition. But really, if you are a cat lover, a cat parent, this is a great video, and I will try to link it. I'm really bad with technology. I'll try to link his full video in the description of my video here, so that if you want to go and hear everything else he has to say. But it's probably the best presentation, or one of the best I've seen, for a cat owner from a practicing veterinarian about how to understand kidney disease, how to diagnose it, and how to, most importantly, how to manage it. And he does a great job. So let's just jump right in and hear from Dr. Burston. And again, I'll be back putting my 2 cents in, of course.
So, cat kidney disease is probably the most important medical related video I'm going to make, because it is super common in cats. About 30% of cats develop kidney disease at some point in their life. And it's probably the most common of the three kind of big common old age diseases of cats. So what is kidney disease? There's many names for it: CRI, CRF, CKD, but all of them really just mean that the kidneys gradually stop doing their job without any specific underlying disease process involved that is easily identified. It's just that you lose kidney function over time. And what kidneys do is they do a lot in your body, but to help you understand how we diagnose and manage kidney disease, you have to be aware of their main two functions of kidneys in the body. One is to conserve body water by filtering your blood and producing urine. And the kidneys reabsorb water, or rather plasma, back into the system. So when a kidney works well, you produce well concentrated urine. And when a kidney does not work well, you produce dilute urine. Another function that kidneys have is clearing byproducts of metabolism. So what we do is we measure byproducts of protein metabolism specifically, and when they're elevated in the blood, we know they're not being filtered at an appropriate rate. And again, we know that the kidneys are usually the culprit. Of course, kidneys have a bunch of other functions in the body that are known by your doctor and compensated for, but you don't really need to worry about that. So the main two jobs of the kidney is conserve body water and filter out metabolic byproducts. And we use these jobs to diagnose kidney disease because we do lab tests. This is why the American Association of Feline Practitioners recommends that blood work be done on cats pretty much every year after the age of 8. And what they mean by blood work is actually blood work and urinalysis, urine testing. So we do both at the same time because you need blood and urine from roughly the same time point in order to assess kidney function. And that's one of the big things we're looking for. And of course, cats over the age of 8 or 9 are statistically likely to start developing some of these old age cat diseases that we look for.
Now, I want to just stop there for just a second, because the good doctor there said something really important. He said around about the age of 8, statistically, that's when cats, their risk of age-related diseases starts to go up. I've historically, in my 30 32 years or 34 years, it was more around the age of 7. I remember seeing charts where you could see the renal disease and all the other disease risks at around the age 7. So there's no gospel number. So 7 or 8 years of age, I want you to get in your mind, he does a good job of explaining it, but that your cat is now geriatric. And what does that mean? Doesn't mean they're acting any different, doesn't mean anything's changed from what you can see, but inside things are changing. Okay, just like us as we age, sometimes we don't look too bad or we don't feel that bad, but we know things are changing. We're not the 20-year-old that we once were, right? That's what's going on at about 7 or 8 years of age with that cat. And he just said basically statistics show that's when these risks start to occur. I want you to think about your own cat. How old is your cat, and when's the last time you had blood work done on that cat to see blood work and urinalysis to see what's really going on the inside?
And kidney disease is diagnosed by looking at lab work and seeing dilute urine and elevated renal values, which are things that should be filtered by the kidneys but aren't being filtered. And the reason it's important to do regular blood work on your cat is because you can find these changes on the lab work years before the cat actually looks sick, which is the ideal time to find them. Because if you diagnose this disease, like with almost any other disease, you diagnose it early, you start managing it, the patient might never even know that they're sick. Whereas, of course, if you wait till end stages when they're 9/10 dead, well, at that point, managing the disease is going to be an uphill battle. And just for your frame of reference, cats can lose like 2/3 of their kidney function before you see anything abnormal in the blood work. So it's not like you're really even getting that early diagnosis to begin with.
So what the doctor is saying here is, are you really getting an early diagnosis by doing regular blood work? I mean, definitely you should be doing regular blood work after the age of 8, let's say 7, 8, 9 years of age. Doing that annual blood work, one, you get a base level so you know what things are going on, and you'll be able to detect changes. But what the doctor is saying here is so true. Blood work could be actually normal for a long period of time, even into years, before what 2/3 of those kidneys are gone, never to return. The function is never going to come back, but the cat was still acting normal and the blood work really wasn't showing it until that stage. So are you really detecting it early by doing that regular blood work? Not really early. It still is critical you do it, but you're always behind the 8 ball when it comes to such an insidious disease. Kidney disease is something you need to be aware of and think about while your cat is young and as an adult. And that's where really good nutrition should come in. And we'll talk about that in a little bit.
Although there is a new biological marker called SDMA that is often measured on laboratory tests. It only came out a few years ago, and it can pick up kidney dysfunction much earlier than previous testing. So maybe now we can pick up kidney disease when like 50% of kidney function is missing roughly rather than 60, so a little bit earlier. But just so you can often pick up kidney disease on labs much earlier than you pick up symptoms of it, because often cats don't show clinical signs of kidney disease until they've lost like 3/4 of their kidney function. So there's a huge gap there between when diagnosis is possible and when it's made if you only look at sick cats.
Okay, so just to recap here, because this is so important, I love this guy. His information is so valuable. That's the only why I'm repeating it here. About 2/3 of kidney function has to be gone before blood work is going to reveal that. Okay. If you're looking for clinical signs, which unfortunately is usually when cat owners bring their cats to the hospital, they're in uremic crisis, they're vomiting, they're sick, they're losing weight, they're not eating. I mean, just a host of things going on. That is typical when a veterinarian sees this cat. Okay. If they're doing annual blood work, great. Then they're catching it a little earlier, but 2/3 of the kidneys have to be gone before blood work shows up. And then about 3/4 of the kidneys have to be gone before the cat shows clinical signs and starts feeling sick. He did mention SDMA, and it's a new test. It's been around for a few years now. It is still new. And I will say, he said about 50%. I've seen as early as only 25% reduction in kidney function, and the SDMA has picked it up. So if you did anything else, if you didn't do a senior workup, you could just do an SDMA test, and if that comes back normal, you're probably good. But if that came back a positive, now you're going to be looking at a BUN, creatinine, and doing all the other stuff.
So what will usually happen is your veterinarian looks at blood work they did on your cat, and they'll see the urine, they'll see elevation in urea, creatinine, and maybe SDMA if they're checking it, and they'll say, oh, your cat has kidney disease or CRI or kidney insufficiency or whatever acronym they choose to use. Doesn't really matter, it's all the same disease. And what this is a gradual loss of function of the kidneys over time. So then the name of the game is preserve existing kidney function, and that is actually what kidney disease therapy is built around. We eliminate any complications like kidney infections and other problems, and then we just manage the kidneys and we try to support their function, and this allows our patients to live a normal life despite the fact that their kidneys are not doing a great job. And again, for your frame of reference, you can live on like 5% of your kidney function. So just because your cat is sick and has elevated kidney values, it's not really the end of the world. There's a lot of room to play with and a lot of leeway to manage their disease and to give them a nice quality of life, often for years and years and years. So there's no need to panic, but there is a need to be proactive about catching these things early.
So are you getting the theme here, catching it early? I mean, how many times has he said it now? That is the key. We can manage the disease. I have a 38-year-old son. My oldest son only has one kidney. So he has to have it checked every couple of years, but it's a little enlarged, but it's fine. It's working fine. And again, we can deal with just one kidney or kidney damage. I don't know, about only 5% left. That's pretty extreme, but the kidneys are so well designed that, that they can really do a great job even when they're compromised. The point is, like he said, is to preserve what's left and not let the disease progress. And of course, to make the cat feel better. That's all important.
This is important because a cat with kidney disease will basically look like a normal cat, normal cat, normal cat. And then they have something called a uremic crisis. This is when their kidneys get overwhelmed, they get dehydrated, they get a kidney infection, they get a little kidney stone, and they have a uremic crisis, which is when they crash, when they lose half of their body weight, they're vomiting, they're ill, they look horrible. And sometimes that is when they're presented to the vet, when they're in a uremic crisis, which is obviously not ideal. And then you get them out of the uremic crisis in the normal cat, normal cat, normal cat, uremic crisis, medical intervention, back to being normal cat, normal cat, normal cat. And again, the goal of management is to just have the cat at your normal cat at all times and keep them out of the uremic crises. But of course, that is not always possible, but it is very, very possible in the majority of cases.
So, as the good doctor is saying, this cat seems totally normal, and then it goes into uremic crisis. And sadly, if you talk to most veterinarians, they'll tell you the majority of the time they see their renal patients in uremic crisis when they're actually showing signs. And what did we just say before? That means about 75% of the kidney function is gone. So that is why blood work and urinalysis after the age of 8 or 9 years of age is so important.
And just a small word about uremic crises. If you do have a cat who is vomiting, losing their body weight, you take them to the vet, and the vet says, oh, your cat has kidney problems. This is a time for aggressive medical intervention because you got to protect whatever kidney function they have left. You have no idea if they're living on 30% of their kidney function or 5% of their kidney function. We don't have kidney function tests that have that level of resolution. So don't stuff around. Once you've diagnosed your kidney disease, your goal for management is to keep that cat hydrated, keep that cat eating, keep that cat's body weight stable, and keep them out of uremic crises. So how do we do this? Let's get into the talk that I usually have with my clients once I've made the diagnosis about what this diagnosis means to their cat and how to manage it. And what we know is that cats with IRIS scores 1 to 3, so basically early to kind of moderate kidney disease, will often live a normal life if that's their condition and diagnosis. So survival times measured in many years for older cats pretty much live out a normal lifespan. The only time you really get a decrease in life expectancy with this diagnosis is if you diagnose a cat in IRIS stage 4 disease, meaning you're really late to the show, which is why I'll never tire of telling everyone to bring their cats in for regular blood and urine testing as they age, so that if they do get kidney disease, you diagnose it early, manage it early, and get normal survival time.
So, how many times has he said it? Early detection, right? normal survival times, normal lifespans living with kidney disease. That is very possible. It's very common. I saw it all the time in clinic, all the years that I saw veterinarians managing kidney disease. But it all came down to, did they catch it early enough in stage 1 or 2? If it's stage 3 or 4, especially if we wait for a uremic crisis and my cat's really sick and you bring him in, um, it's a whole different story. It's a very sad story. Time is very limited at that point. So I don't know how many times he said it, but early detection and prevention or reducing the risk, that's key.
There are three pillars to managing kidney disease. Two of them are really commonly accepted. The third one is less so, but should be. And they are food, hydration, and calcitriol. So let's talk about food first. The earliest studies on kidney disease and diet have been done using something called Hill's KD or Hill's kidney diet, and they demonstrated significant increase in survival time and reduction in frequency of uremic crises in cats who are fed a proper diet. And proper renal diet is one that's restricted in protein, sodium, phosphorus, there's a bunch of other stuff added. I don't really know what it is because I'm not a veterinary nutritionist, and I don't need to because other people designed this diet for me.
I just love this doctor because, especially at the end there, I don't know exactly how this diet works and everything in all the details of the diet because he didn't formulate it. Other people did that for him. He just sees it work. Okay. And so for all of you out there, when you tell me and you send me a comment, or for those of you that hear it from your friends, whatever, veterinarians don't know anything about nutrition. They don't get a lot of study in vet school and all. You know what? That's really not true. But the point is, they don't make those diets. He was very honest to say, hey, I don't know all the details. I just know the diet works. And he did mention the research done. Yes, KD was the initial research going into renal disease back when Buddy, one of the very first seeing eye dogs in America, was very famous, traveling the world back in the late 30s. And she came down with kidney disease. And it was Dr. Mark Morris, who was the veterinarian way ahead of his time. And I talk about him a lot. His son, I actually got to be taught by his son years later, Mark Morris Jr., Dr. Mark Morris Jr. But he was the one that came up with the first renal diet to actually try to manage the progression of the disease. And of course, the rest is history. So here's a veterinarian just with the little bit of knowledge he knows. He knows a lot of research was done. Veterinarians love that. Uh, and he knows he doesn't have to be the expert. There are board certified veterinary nutritionists. There's not a lot of them in the world, but many have gone through Hills at different times in their careers because of the research facility, and they just want to be part of all the excitement going on there and all the great discoveries that are made. And he knows enough that, hey, I don't have to be the expert. That's what those people are for. But he sure is going to recommend that food. And he does a nice job.
And what I know is that there's different levels of renal diets. There's stuff like KD and Royal Canin Renal, which is for advanced kidney disease. There's also senior cat and early renal diets from both of these companies that are for early kidney disease. Because of course, cats are little obligate predators, obligate carnivores that need a lot of protein to stay healthy. So you don't want to restrict a cat in their protein intake too much too early, because maintaining body weight is a big part of the battle in managing kidney disease in cats. So you want to have a moderate protein restriction at early stages of kidney disease and a slightly more severe protein restriction at later stages of kidney disease. And neither you or I really need to know much more than that. You just need to pick the right food for the stage of kidney disease.
So here I'm going to kind of disagree with the doc just a little bit. Yes, Purina and Hills, and I'm not really sure if Royal Canin has made an early stage renal diet, but Purina and Hills did. The Hills early stage, I think they call it, it's 13% more protein than KD. Um, and that is for doctors like this doctor here that if they catch it early enough, now because of SDMA, maybe that's a valid point that we're catching it that early. Let's not restrict protein so much. I will say I'm not aware of a lot of research that's gone into what would be the appropriate protein level for stage 1. Okay, for years in most of my career, doctors went immediately to KD. Now, in recent years, what Hills has done with KD, they've actually added broken down amino acids to the diet, which is what the muscles need, right? They need protein, but which is amino acids. So instead of just adding meat protein, they're adding broken down amino acids. And I can tell you, I remember this number, the NRC, National Research Council, the amount of amino acids in the KD diets is 160% of the minimum that NRC is saying is necessary for a normal, healthy cat. So when we say protein restriction, it's kind of misleading because it sounds like it's really low, super low. We even use the word low, okay? The doc probably did. That's compared to what? What have we looked at some of the videos that I've made looking at cat food? 50, 60% protein, crazy protein numbers, okay? If you have a normal, healthy kidney function and you're not prone to kidney disease, that's probably not going to be that big an issue. But if you're prone to kidney disease, or you just, the one thing I wanted you to get from this whole video and what the doctor was saying, for years, right now, you cat owners listening right now, if you haven't done blood work in the last year or two, you have no clue whether your cat's kidneys are in 50% decline. You really have no clue. The blood work won't show it till about 2/3. Your cat's not going to act sick till about 3/4 of the kidneys are gone. So the whole point of nutrition is, okay, let's feed optimal protein levels to these cats. He mentioned senior diets. We've looked at some senior diets. There's nothing senior about them. They're not restricting protein or restricting phosphorus and sodium and things like that. It just says senior on the bag, but there's nothing senior in there as far as reducing the risk of disease. So the whole point of nutrition here is, yes, catch it early, do an SDMA, if nothing else. It's positive. Get them on a controlled diet. Get them on a good senior food, and Hills is the best when it comes to those nutrient levels. You guys have seen the numbers. But let's start managing the disease if it's there. I mean, if it's stage 2 or higher, I'm going with KD. KD, we've had cats, normal cats have been raised on, generations of cats have been raised on KD. There's no deficiencies. Again, it's just we're so used to such high numbers that when you see the numbers in Hills, I get the comments, there's not enough protein. Cats are true carnivores. There's plenty of protein that's been proven scientifically and by all the cats thriving on it. Okay. But more important than that, what about that normal healthy cat that's 8, 9, 10 years of age? Do the blood work. Okay. Even though it's still not going to show any issues for a while, because it's not going to show any issues, doesn't it? Here's the question. Doesn't it make sense to feed a diet that controls the phosphorus and the sodium and gives you protein levels that are more at an optimal rate for those kidneys to not be overtaxed, having to deal with all this extra nitrogen waste, all the byproducts of metabolism? Why would you put your cat through that, or her kidneys through that, if she's one of those, what, 1 in 3, 1 in 4 cats that's going to come down with kidney disease? It just doesn't make any sense. It makes sense to be proactive and be preventative, if you want to call it that, preventive nutrition, and feed something that's reducing the risk of such a common, horrible disease as kidney disease. That's the whole point behind geriatric nutrition. And that's why this whole biologically appropriate and feed your cat like she would in the wild and all, none of that applies. Your cat is now 8, 9 years of age. She's older than she ever would have been in the wild. She'd be toast. She'd be worm food now if she was in the wild. Now she's got age-related diseases that we can use nutrition science to manage rather than just letting her die the way nature would.
So diet is very, very important. It is an absolute keystone to managing kidney disease. You have to get these cats on an appropriate renal diet for their life stage. That's all that I'm going to say about that, but I'm going to tell you that if you don't follow your vet's advice and put the cat on an appropriate renal diet, you're going to not get a very good outcome.
You're not going to get a very good outcome. Let me rephrase it. If you feed a food to your cat that is not designed to help protect those kidneys and reduce the progression of kidney disease, you're basically harming her every time you feed her. Let that sink in. Okay. So when you go to all these different Facebook groups and you go listen to these holistic people, the all natural, the Dr. Jones and the Dr. Judy and the Dr. Beckers and all that, show me the research, show me the evidence, show me the thousands of pets that they have helped with renal disease, with their all natural and holistic approach. I'm sorry. I think you're crazy to go that way. Why would you take the risk to do that when you have all this research? Here's just a veterinarian. I don't know how long he's been practicing, probably for a while. He's seen the results of these diets. He trusts the research. He's a research guy, or he wouldn't be a veterinarian. Dr. Ray, same way. Loves research, I'm sure. That's why she's looking for evidence, not for feel good philosophy or anything like that. So when he says, he said, trust your vet. Amen. That's what I'm trying to share with you. Please, I see the comments all the time and I try to help people, but I hate seeing the frustration and the concern and the guilt sometimes. Just, I mean, we lose our pets. It's hard enough to feel guilty that we could have done something better and we didn't, because I listened to some crazy holistic vet that told me how terrible my vet is, how he knows nothing about nutrition and those prescriptions. I just was commenting to a couple of people on Facebook today. Hills is just garbage. It's rubbish. It's blah blah blah. But that's why I do these videos, okay? And I'm going to keep sharing. If I find more videos by veterinarians that get it, I am going to share it on my channel. I'm not here to promote me. I'm here to promote the truth so that you as pet loving pet parents will understand that there's too much fear mongering, there's too much BS, there's too much pet food marketing and snake oil salesmanship going on out there, and it's harming pets. It's hard on us because we love our animals so much. That's why I make these videos. So please like and share these videos. If you have a cat person in your life, definitely send this video to them. And again, I hope I can figure out a way to attach the full video from this gentleman on the bottom. Last thing I'm going to say about his video, because this is going too long, is he definitely recommends canned food. Why? For all the added moisture. Everybody knows that, right? Okay, I got to make my good friend Ed happy by saying yes. After what the doctor said is after the age of 8, we really should be feeding canned food to get a lot more moisture into these cats. If your cat is 8, 9 years of age, that's like 60 or 70 in people years, and there's a lot of health risks. So start adding canned. Okay, that's really important. Don't throw the baby out with the bathwater and just think, well, any canned is good. No, it still has to be a canned food that's designed by board certified nutritionists, that's giving you optimal protein level, watching that phosphorus and sodium level, adding some vitamin K and some other things, potassium, things like that the cat needs now. Maybe some added fiber usually is typical in a senior cat food just to keep the GI tract healthier. All that's great stuff. That's what nutrition science gives you that nature doesn't. And these celebrity YouTubers, they don't get it. Okay, what did I say? Those are what? They're not nutritionists. They're ingredientists. Don't listen to the ingredientists. Listen to the nutritionists. Okay, and this is what this doctor's doing, and I'm sure he is blessing a lot of animals and a lot of pet owners in his clinic over there in, where is he from? From Canada. Yeah, so go Canada. Thanks, guys. Hope this has been helpful. Let me know.